This is unusual doing a YouTube at night. 7:42 in the evening. I'm here under light, and it's pitch black outside. As we wander into fall. And I came across an article from the University of North Carolina about radiation. I can't tell you how many people have called me that are in the battle for their lives with cancer. And one of the options that they come upon is radiation. And they're always concerned that, what's that radiation going to do to me? Is there going to be a detrimental side effect to the radiation? And I find it very intriguing when I read this. This is coming from the Lineberger Comprehensive Cancer Center. The takeaway message. It's for you, for me, and the fact that this YouTube video can be shared with others is critical. Critical. Is there one simple thing that someone could do to protect themselves from some of the detrimental effects of radiation? Now, the reason I'm doing this show late is I've been just completely distracted by this election, and I've been praying for this country, and now I think more than ever we need more prayers for this country. The next 4 years are going to be sad, and never give up hope. Never give up hope. But thank God I don't have to be working for a living. I do this because I love it. I feel sad for those that are just coming into the workforce that are going to be paying the brunt of what's going to happen here soon. I feel sad for the unborn, which is primary reason number one I was voting for Trump. But I guess the rest of the other half of this country thought differently and could care less about the lives of a baby. A new study by scientists at the UNC Lineberger Comprehensive Cancer Center, published October 30th, just a couple days ago, in the Journal of Science, showed that mice exposed to potentially lethal levels of total body radiation were protected from radiation damage if they had a specific type of bacteria in their gut. We're going back to the microbiome again. Radiation absorbed in a clinical setting or during an accidental exposure can cause damage to tissue. So could this also reduce the risk factors of sun radiation? Think about that. In this study, the bacteria mitigated radiation exposure, enhanced the recovery of red blood cell production, as well as repaired the gastrointestinal tract. So one of the major side effects of radiation is the depletion of red blood cells. And doctors will traditionally go through a level of radiation with a person until they reach that point. And then they have to stop, let the body try to compensate back, and then start again. The researchers noted that only an elite set of mice had a high abundance of two types of bacteria, Lactospiraceae and Enterococci. They had these in their guts that were strongly countered the effects of the intense radiation. Importantly for humans, these two types of bacteria were found in abundance in leukemia patients with mild GI symptoms who underwent radiotherapy. The study showed that the presence of the two bacteria led to an increased production of small molecules known as propionate and tryptophan. These metabolites provided long-term protection from radiation, lessened damage to bone marrow stem cell production, mitigated the development of severe gastrointestinal problems, and reduced damage to DNA. Probiotics. Both metabolites are in health supplements. This truly trans-UNC collaborative effort showed that these beneficial bacteria caused a profound change in the gut metabolites, said author Jenny Ting, T-I-N-G, the William Rand Kenyon Professor in Genetics. Damage to bodily organs from high levels of radiation, either from accidental exposure, cancer radiotherapy, that's where we're going with this, targeted radiation attacks, among other forms of exposure, can lead to serious illness and even death. Could probiotics save your life? Could probiotics and should probiotics be a number one for anybody going through chemo? Blood cells in the body, as well as tissues in the GI tract, renew quickly, and therefore remain particularly susceptible to radiation damage. On the protective side, however, the GI tract hosts over 10 trillion microbial microorganisms. 10 trillion. That's going to be what the Biden tax increases are going to be. That could, only kidding, could play an important role in limiting radiation-induced damage. Substantial federal efforts have been made to mitigate acute radiation symptoms. However, it remains a long-standing and unresolved problem, said Dr. Guo, G-U-O, a postdoctoral fellow at Dr. Ting's lab. Our work produced a comprehensive data set of bacteria and metabolites that can serve as a powerful resource to identify actionable therapeutic targets in future microbiome studies. Because radiotherapy that's widely used to treat cancer often leads to GI side effects, the investigators wanted to understand how their experiments in mice could translate to people. They worked with colleagues at Duke University, Memorial Sloan Kettering, and the Weill Cornell Medical College. They studied fecal samples from 21 leukemia patients due to receive radiotherapy as part of their arduous stem cell transplant conditioning. The scientists found that the patients with shorter periods of diarrhea had significantly higher abundance of lactosporotiae and enterococci than the patients with the longer periods of diarrhea. These findings correlated closely with the researchers' finding in mice, although Dr. Ting cautions that much larger studies are needed to verify these conclusions. What are you worried about, Doc? Importantly, for potential human use, in mice that were supplemented with lactosporotiae, the benefits of cancer radiotherapy. Granulocyte colony stimulatory factor is the only drug that has been approved by the FDA as an effective countermeasure to high-dose radiation exposure. But it's expensive and has potentially adverse side effects, said Ting. However, bacteria that we can cultivate, and especially metabolites that are relatively inexpensive and already elements in the food we eat, may be a good alternative. The researchers are hoping to launch a clinical trial soon in people to test the benefits of giving these metabolites to patients receiving radiation. There. Want help with that? Call me at the office, 678-228-8900. Check us out on the website at thenutritionshop.net. Check us out on Facebook. We have a whole bunch of new ads coming out. I think it's starting tomorrow, so check those out. Hopefully tomorrow I'll be doing this in the daylight. But today was golf day, so I had a chance to get out and enjoy a 77 sunny day. I got my head away from this election. God help us in this country. 678-228-8900. God bless you, folks, and I'll see you back here tomorrow. Take care.